All right, guys, we're going to chat through the GHD back extension, or more appropriately termed, hip extension, okay? Because it's not actually a back extension, it is a hip extension. And this is a low back hamstring glute exercise, a phenomenal exercise that should be utilized on a very regular basis in all programming. But it's one of those exercises a lot of people misunderstand greatly when they get in here. It's one of those, it's kind of like a handstand push-up. When you're upside down, it's hard to know where you are in space. So we're gonna go through the basics on here of what we're actually looking for, and then we're gonna go through some of the faults as well, all right? So the very first thing that has to happen in any position is you need to get this machine set up to the appropriate height and distance. Now, just note that this also goes up and down. So the lower this is, the more flexion it's gonna put on the individual in the position. So if you have someone with a tightened hamstring or posterior chain on their hip hinge perspective, you're going to want to rise that up. Now, right now it's on its lowest position because it was being used for GHD raises. So I'll just continue to use it in this position as it is. When you're setting up this position, it's going to take a little bit of experimentation and play, but what you're going to want to find is where the position is farthest back that doesn't influence hip positioning. Okay, so I'll give you an example. I'm going to go to the very farthest back position that we can put this in. And for my height, when I get in here, right away my belly hits, so I can't have proper hip extension. It rounds my back. So that's a first indication that the machine is set too far back. If I was to set it too far forward, when I go to get into the machine, the very first thing that athletes are going to complain about is the fact that it hurts the quads, because you have all your body weight out here resting on your quads. And you can see that I can do the exercise correctly from here. It's just a lot harder because I have so much more of my mass out here. My leverage is off. So you want to make sure you set this up correctly so that you're as far back as possible, allowing appropriate hip flexion. Now, when we talk about hip flexion, what we're looking for is to start in a neutral position, and as we come down, is to release the glutes and the hamstrings and allow the back to remain flat throughout the entire position, rather than this, where a lot of people are going to get caught. A lot of people have a difficult time in this position learning how to relax the hamstrings and the glutes on the eccentric component, so that when they stay tight here, they just round from their low back. So you want to think about pushing your hip bone up to the ceiling, relaxing. So a lot of times what we can get athletes to do is just simply relax the bottom and tactile cue the bottom position to make sure they understand what it would feel like. It would look like this. If someone's having trouble, just relax. Relax and hang all the way down here. Now push your butt up to the sky, and now squeeze the hamstrings and the glutes and pull yourself back up. Now usually, when you're first learning this, a coach can have a handout or some position to make sure the athlete's not overextending. It's not necessary to overextend. We can come to neutral or slightly past neutral. We also want to watch the athlete, how they're moving through the position. Are they extending the back, or are they truly using the glutes and hamstrings? And I like to try and get all the athletes to internally cue and understand this position, so when they come to the top, that they're squeezing the butt, squeezing the hamstrings as hard as possible, versus squeezing the low back. A lot of athletes will complain of pain in their mid-back, which is just, they're over-contracting and overextending, usually through the thoracic lumbar junction. So we want to make sure that they're also keeping the front line tight, okay? Now this is going to transfer to any other exercises we do in the weight room, because this is how we move. This is appropriate movement patterning. So I'll show you a correct one, and then an overextended thoracic lumbar spine position. Correct? Incorrect. And even as you see it, you can note that it's obviously a position that's got a little bit of extreme position to it. It's going to feel awkward, all right? But again, have the athletes internally cue to feel the squeeze, and you as a coach will also be able to see it. So something that you can visually see, the athlete can see and internally cue themselves and feel the position correctly, okay? Now that, guys, is the back extension, or appropriately termed the hip extension.